My name's Dr. Robert Dixon, Dr. Bob. Most of you know me. I've been working on this issue for 20 years now, and I'm here to make your work actually easier. I know you people have a really hard time here. You have so many things on your plate. You have so many responsibilities. This one should be off your plate. It should be done and gone, and that's because the original motion from 2011 still stands. Thank you, Drew and others. So basically what we have happening here is the old guard is going down. The old guard, like the older dentists, the gobsats, the good old boys sitting around tables, they're going down. The new guard's coming up, people that are concerned about actual health, the well-being of all our people, all our children, and not just the well-being of teeth. How do we get this up here? Yeah. Thank you.
And these arrows will drive you.
Okay, first of all, fluorosis. It's a very real thing. A lot of the modern day dentists and some of the research shows, oh, it's not that bad, it's just cosmetic. Well, one of my dentist friends down the street treated 2 kids not very long ago that grew up in fluoridated Calgary Times, $50,000 plus each to fix their fluorosis that happened because of Calgary's fluoridation in the water. So people say, oh, nobody's opposed to this, or at least it's all quacks and people in the outlying areas. There's thousands of professionals that oppose water fluoridation. There's an open letter signed by 4,800 professionals. There's Nobel laureates. There's 14 of them right here that have had the courage to step out and oppose water fluoridation at risk of their careers and their livelihoods. We talked about the Scottish Child Smile program briefly. That is the best program on the planet right now. Scotland doesn't allow fluoridation anywhere in any way, shape, or form. And they had problems with tooth decay as well. They started this in the early 2000s. And now, look at the numbers there. Look at the numbers at the bottom. Actually, that third statement is probably one of the most powerful. It helps parents establish a healthy diet from the earliest stage. What would that do to teeth health, to oral health, to full body health? We'd have millions and millions of dollars of savings from not just the dental work, but from overall health, decreasing obesity, and decreasing all the other things like diabetes that kids get now because their diet is so poor. But the last 2 lines there talks about the savings. It costs them about $3 million a year. For the province of Alberta, that would be peanuts. I know you folks don't want to spend that now with your budget crunch, but the province certainly could. And it saved more than $11 million Canadian in January of 2018. So huge savings to be had, plus we've got healthier kids. There's just a couple of statements from them. I like the last one in particular. It says, we believe that the success of Child Smile is because from the government down, the Scottish people want health equality, and they are willing to collaborate to achieve it. We've got to collaborate, folks. We at Safe Water Calgary are willing to collaborate with anybody to make our children's health better. So our request from Safe Water Calgary is, we implore those who are in favor of adding a known industrial toxin into our water to look at all the science and look at it closely. Look at all the countries in the world. 95% of the world doesn't fluoridate. Give all people choice. You're taking away choice by putting a medicine in our water. And work with us, with Safe Water Calgary, to make child health a priority in this city, in this province, in this country. We'll all be better off for it. Why should we say no to fluoridation? We have on our side, on our Safe Water Calgary side, on our anti-fluoride side, we have the science. Over 4,000 studies out there, anti-fluoride. And especially the newest ones that are out are getting strong and stronger. There's one out just last week on ADHD. There's another one in the pipe that's going to be even more powerful, probably coming out in January. We have the ethics and morality. It's not ethical to mass medicate people, folks. I'm a doctor. It's not ethical without informed consent to mass medicate people, especially without control of dose or dosage and without any monitoring or follow-up anywhere along the road. Take as much as you want for the rest of your life, never come see me again. We have the economics on our side. The economics from your end of things, of course, that makes sense. $6 million for infrastructure, $1 million right up front, that's $7 million this year. Do you have that anywhere in your budget? I don't think so. $40 million over the next, $40 to $50 million over the next 40 years to save 1/2 to 1 cavity in that 40-year period. Is it worth it? Absolutely not. And of course, we have common sense on our side. Who would ever put a known industrial product into the water and say, take as much as you want and see you later? This is a quick statement by the National Academy of Sciences in the States, and they say that kidney patients, diabetics, children, and senior citizens are susceptible populations vulnerable to harm from ingested fluorides. What's this no harm, safe and effective stuff that I've been hearing all morning? The scaremongering that these people do, that the pro-fluoridationists have done all morning, all the infections and everything, that stuff is awful. It has nothing to do with water fluoridation, however. Here's a statement from an area in the United States that applies very much to Calgary. It's the duty of city governments to ensure the rights of residents. These include civil rights, conservation of the environment, and fiscal responsibility. Fluoridation policy fails on all counts. Remember, that 2011 motion I talked about earlier is still strong and viable. The only thing that is different from that motion is that you can add in neurotoxicity and you can add in a lot other strong studies, fluorosis being one. As I mentioned earlier, there's hardly any place in the world that fluoridates. The pro-fluoridationists make it sound like we're outliers here, that we're kind of missing the boat here somehow. Well, 97% of Europe does not fluoridate. Yeah, a couple of people sprinkle a little bit of fluoridated salt on their food, but hardly any. 98% of Quebec and British Columbia right beside us. British Columbia has some of the best teeth in Canada, the best kids' health in Canada. 98% of them do not fluoridate. And Europe, much more progressive, 97%. So there was that statement from before, $40 to $50 million over 40 years to save one tooth. Is it worth it? I don't think so. And remember the precautionary principle. If you're uncertain, don't do it. If you're uncertain, do not do it. We have this upside down here. We're going to put this poison, this toxin in our water, and if you can somehow find the funds, find the people to stand up, have the courage to stand up to it and do the studies, well, maybe we'll look at taking it out. That's not the precautionary principle. The precautionary principle says, if you're in doubt, don't do it. We are definitely in doubt, and more so every single day. Here's where we should put water fluoridation. We should put it in the Museum of Failed Medical, Dental, and Public Health Practices. That's where it belongs.